Cosmetic family.
Hey, welcome to the Cosmetic Podcast.
Cosmetic means being a person or thing that gives rise to a phenomenon that is dynamic or energizing.
We're tackling topics and telling the truth.
I'm Roderick Ross.
And I'm Keith Benson.
So today,
yes.
First of all, we have stars, Rookie of the Year awardee stars in the midst.
Folks about who is the Rookie of the Year.
So we have these two wonderful individuals who are co-chairing the Mental Health Innovation Team, because this is another installment in the Innovation Series that we are partnering with YUSA. We have Sarah Johnson and Rookie of the Year awardee Keesiya Robertson. Welcome to the Cosmetic Podcast. Woo! Yes.
Man, I want to. What's this Rookie of the Year?
First of all, you've been in the game way too long to even be thinking about rookie in anything. Your rookie days are over.
And why did that level of shade just come over me when we're trying to have an engaging conversation here? But you know what?
I just needed to set the ground level.
You know, back in the day, we used to do a thing like this. But I won't do that today, though.
When you were a rookie back in the day.
You know what? We're going to keep on with this one right here.
We have the real rookie, the real superstar, the awardee. Keesiya, tell us about that. What does that mean to be the Rookie of the Year?
Well, we have different rallies and different things. And at the time of our all-staff rally, I had only been with the YMCA of Metro Chicago for 5 months. And in 5 months, I had done, I guess, so many great things. They were like, we have to recognize you as the Rookie of the Year. So I was so excited. Sarah was there to root me on. And like this phenomenal relationship has like grown and blossomed since then.
Yes, good. That's right, Chicago.
What were some of those dynamic things that you had done?
So in 5 months, I was able to build the process for our behavior support plans in Chicago. I'm the behavior support manager for YMCA of Metro Chicago. I was able to connect us with 2 of the behavioral health hospitals to get some free professional development. You name it, I'm doing it and trying to do it. So yeah.
Well, that's why she won, Keith. That's why you didn't win when you was a rookie, because you wasn't doing that kind of work. Got him.
But they ain't had no Rookie of the Year back when behavior health. We're talking about behavior health today and mental health with our 2 dynamic leaders right here.
Yes.
Man, that is a pretty heavy topic.
Yeah.
So here's the way, as we're talking about partnership with YUSA in this innovation series. Your job alone, both your jobs alone, wasn't a thing 25 years ago, right? And so you all are entering into this space. What are you guys seeing right now in the space that you're in, and how you're delivering your message and your services?
I can start. The first thing that I'm seeing is the work has always needed to be done. But now that we're getting into that space, it's a matter of mind transformation. So really talking to people and getting them to understand the importance of the work and why we all need to band together to do it. Because if not, we all are going to just absolutely lose it. So a lot of what I've been doing is really trying to show people why it's important, show them the outcome if we take the time to put in the work to build the youth that are in front of us, because I'm a firm believer in the fact that what we do today is helping to build our youth of tomorrow. So I don't just, think about, oh yeah, this is the youth, they come to program today and then they leave and that's it. It's like, no, everything we pour into them is going to grow into something. So we can pour positivity into them, or we can pour negativity, and I'm all about pouring the positivity into them.
Yes, ma'am. Yes, ma'am.
Yes, ma'am. Sarah, I have absolutely noticed that, particularly in the last 2 years, having the opportunity to sit in a number of different national cohorts, with people internal to the YMCA, that more and more you and the work that you're doing is being centered, because the pandemic has made people realize in a very different way the importance of mental health, right? And the fact that you were already in the trenches and doing it, we're like, please give us the cheat codes, Sarah.
Right.
So here is your opportunity. What are the cheat codes,
yes,
Sarah? We need them.
Please.
Like, there are so many whys that mental health is anchored in their strategic plan, but all of those whys will say, we really don't know what that means.
Right.
Like, Dallas is one. Like, we're still trying to figure out what that means.
Yep. Oh, I love this. And thinking, I totally agree with what Keesiya said there too, which is that mental health has always been a thing. We've always all had it. It's just now more recognized, like you were saying, that, oh, there's an urgency around this. And, we had a youth mental health crisis that predated the pandemic. And now we have entered into the pandemic. We're still mid-pandemic, and we're just seeing, going to continue to see, I'm sad to say, some really difficult times. And so really central to the work that we've said all along. And I started as a community partner with a Y, and then was actually full-time as a Y employee. And now I'm outside of the Y working with Ys across the movement. So I have some different perspectives on this. And I really always said we all have a role in mental health, and it's great to have a mental health director. It's great to have a behavior support person. It's great to have some of those roles, but everyone on the pool deck needs to know how to talk about mental health. Everybody at the member services desk needs to know how to talk about mental health. And I'm not saying everybody needs to be a therapist. There are some really key behaviors that we're talking about here. At its most basic, we just need everybody to know how to take care of themselves and each other effectively, how to be community. Truly.
I love that. Just really helping, because it is definitely one of those topics that seems so ominous and so big. And much of the discourse is around, when you say mental health, where's our entry point? Is so much we don't even really know what that means. But the way you're saying, Sarah, like, look, we just need you to know the basics to take care of yourself and recognize when someone else needs some help. I think it's an amazing way for YMCAs to begin to just kind of settle down and eat the elephant one bite at a time.
When you're talking about, I mean, it's a part of self-care, but the recognizing part, that's what I wanted to touch on just for a moment, because I've had, just within this year, there's been a couple of situations where clearly someone who had walked into the facility and you could visibly see that there was something wrong, and our welcome center staff just kind of froze because that's not the service that we typically, we don't train them to how to handle that situation. If I come in, I want a membership, hey, our staff is ready to handle that right there.
Or even if someone has a heart attack, like we take first aid, we know what to do in that kind of situation.
I mean, I'm just thinking that scenarios, a couple other scenarios, I saw some reports come across that there's clearly someone walked into the facility and there was clearly something visibly wrong with them, but we not necessarily equipped our frontline staff. And I say frontline because great, I can go through the training. I'm not the first one. Matter of fact, what are we doing for our day camp counselors? What are we doing for our welcome center staff right there? I don't know, what recommendations do you all have that you can be able to share with folks?
Yeah, Keesiya, do you want to?
A lot of what I'm looking at and doing is building our leaders in every capacity, part-time, full-time, you are volunteering, and really looking at the professional development we're offering and making sure all of the information that we're getting out there is trickling down. So we're really looking at the process of, if we give our youth development leaders a professional development, how are we then passing that information along? Because as you said, it's great that I have the training, but I'm sitting in my office, in our metro office, and I'm not as effective as the person that is encountering this person. So we're doing a lot with trying to get grants and different things to make sure that our staff are first aid and mental health certified. Again, so that they can be first responders, so that if you see something, you know what the next step is. And our motto now is, if you see something, say something. If you don't know what to do, if you don't know, pick up the phone and call somebody so that you can get the help that they need. So we're absolutely trying to look at how the information is being disseminated across everybody, because that's the most important.
Yeah, I love that.
I mean,
making sure it trickles down.
Yeah, what in terms of associations, what should they start with in terms of with that the training that you're talking about, and who should get it?
This is a great question.
Yes,
everybody right now, all of it. Yeah, no, we really recognize that we all need to know how to care for ourselves and each other. Like, who do people go to? They go to their peers, right? I want to know that all of my friends know what to do to take care of me. I want to know that teams at the Y know how to take care of each other. When somebody walks in the door, they see their role as, okay, I may not know how to solve this, but I know how to support you and help you, right? So in terms of where can Y start, there's some really great resources on link. So we'll make sure that you have the mental health community page.
Yes.
That's a really great place to look. And in particular, the Go kits, we designed specifically to be pretty much like bite-sized pieces. So there's several different topics, and we have them in order of what really makes sense, starting with what is mental health? It's just how we think, feel, and act, and kind of practicing saying, how are you, and meaning it. This is the level we're talking about. Like, that is, if you're genuinely showing up and doing that, that's a question about mental health. And that's a door to building a relationship and a connection with someone, which is medicine, essentially, right? Community is medicine, connection is medicine, and that's what we do at the Y. So looking at those Go kits, watching the videos, which are all about 8 minutes or less, and then going through the learning guide, which has some key concepts, some key vocabulary, and then just a few reflection questions, because it's a dynamic process, right? Like, being trauma informed or being, building a culture of mental health isn't like a check mark. Oh, check, now I know how to respond to everything. It's really, how do you learn to show up? How do you get comfortable seeing yourself as a help giver? How do you get comfortable role modeling help seeking and effective strategies for taking care of yourself? Like, how do we role model that stuff? That's an ongoing learning. I'm learning, and I talk about this stuff all the time, and I don't always know what I'm talking about. I do it all right.
I love that. Modeling how to take care of yourself. Many times when you get into certain levels or certain positions in the YMCA, right, you just feel like you always have to epitomize this grit and this always on and nothing bothers me and I'm 100%. And when you think about it, is that a realistic model you're putting in front of your young staff, your nascent staff, people who are early in their career, who are absolutely going through things, but they're figuring, well, if they always so put together and that's where I want to be, I have to. So I love that, not necessarily just recognizing in other people, but how do you model that authenticity and show people, look, I ain't always put together. Now, I will wear cute shoes on Fridays, let's be clear. But the rest of the week, I don't know. It could be up and down.
She's gonna wait till Friday.
I'm gonna wear my cute shoes on Friday. That I'm gonna do.
I start off on Monday, and then
it just go down.
By Friday, I look like, what you got on?
I'm like, Kiva, that's your pajamas? What is really going on here? Oh my, it must be Friday.
It's been a couple of years.
Yeah, you mentioned those Go kits, and
that's good.
we there's a lot of good nuggets in there. We talked some about self-care, but building resilience was one of those in there. What's in that bucket right there? Maybe we can walk through some of the others also.
Yeah. So some of the other, let me see, I didn't have them pulled up.
I got you covered. We can talk about building resilience, and then we can talk about the conversations of mental health, and then we can talk about being trauma informed. I have these memorized.
He does.
I have these memorized off the top of my head.
He is dangerous with a link. That's where y'all messed up. You gave him too much information.
Yeah, but I just wanted just to talk about some of these different ones up here, and I know you got different videos and stuff in there, but why are some of these buckets important? And then, like, how can you utilize some of those things, or when to utilize them also?
Yeah, I can start, Keesiya, if it's okay. So, really, when we are talking about building a culture of mental health, we're talking about a specific set of knowledge, skills, and behaviors that we're looking for. Like I said, we're not trying to train everyone to be a therapist. We're trying to just really raise our mental health literacy and increase healthy behaviors. And, you know, because it's one thing to know something, it's another thing to do a thing. Kind of like I've been telling people lately, like, I know I shouldn't put cheese on everything I eat, but now I do because of the pandemic. It's just what I do.
Delicious.
Mine is bacon, so don't worry about it.
Food's so delicious. I shouldn't have dessert all the time, but I do.
But now you put a piece of bacon on some salmon like I had the other day. Oh my goodness.
Yeah, I don't really think that's what she wanted us to grab onto.
I know. And I'm hungry now.
Yes,
so keep going.
So we're looking at how do we help both, you know, increase people's knowledge around some of these topics, but then also how does that move into different actions, right? A shift in actual perspective and behavior. So we're looking at a number of things. We're looking at helping people be able to ask those questions of how are you? We want people to be able to identify those signs when somebody might be having trouble, and whether it's themselves or someone else. We really want to normalize both help seeking, right? Like, okay, I'm having trouble. I can see that it's helpful to ask people for help. I value it. I don't feel weak or whatever, you know, all those things that we tell ourselves, but when we're, you know, could ask for help. We also want to normalize help giving, right? So seeing our roles as it is my role to help out, whether I'm in the grocery store, at a YMCA, at a church, synagogue, temple, whatever it is, right? We also want then people to know how to respond. So when I think about mental health care, so, you know, I'm trained as a mental health professional. I have a license. I saw patients as a therapist for many years, and now I'm kind of more in the public health mode of it. But if somebody was lucky enough to have insurance and a copay they could afford and experience with the healthcare system that led them to believe that they could trust me as a healthcare provider and the healthcare system, like all of these things need to line up, like a job or a school that could allow them to go, right? Like all these things had to line up.
Yeah.
Even if somebody was privileged enough, lucky enough to be in that position, they would probably see me less than 2 hours a month. The rest of their life is spent outside of the clinic, right? The rest of the, you know, when I've seen a therapist, I see a therapist for this little amount of time, and then the rest of my life, I'm with my friends and my family. They need to know how to support me outside of the clinic. So those are the kinds of things that we're wanting people to know what to do. So how do you connect somebody to formal support if they need it, and it's beyond the scope of what we can do as Ys, as you know, peers, as family and friends? How do we connect? But we also need people to understand that we can't self-care our way out of this stuff. We can't therapy our way out of this stuff. We need serious systems change to address the social determinants of health. So the places where we work, play, live, right? We need to get health equity. We need safe neighborhoods. We need safe homes. All of those pieces are part of those knowledge, skills, and behaviors. I got all fired up. Sorry, I got goosebumps.
I love it. You're dropping nuggets. I love it. It's because it's all interrelated, and I think sometimes in an effort to just feel like you're making some progress or some headway in a topic that can feel so large, we compartmentalize stuff, but not realizing you can't do that because they're so interrelated. Like if a person is fearful constantly of their safety because of the neighborhood that they live in, right? Or if they're constantly living in, you know, less than conditions, they don't have running water or their power is off because they couldn't pay the bill, that absolutely affects their mental health. Like I've heard some people who have unfortunately grown up in environments like that and continue to live like that as adults, compare it to a form of PTSD. And you can't compartmentalize and say, well, let's only talk about this thing, because if all of those other things were fixed, then this problem would probably be substantially lessened, and they could, you know, see some resolution. So I love the way you're talking about the interconnectedness of the social determinants of health and people's mental health. You can't just compartmentalize and say, yeah, go to your therapist 2 hours a month and you're going to be just fine.
Right.
Man.
Yeah,
And if I
love
can
that.
add to that, I know that you asked, like, how do you use it? Where do you use it? And the very nature of the Go Kits, because everything's broken down within the Go Kits. You have the video that explains the topic, that discusses the topic. So it introduces, whether you're talking about building resilience, self-care, effective coping skills, it breaks down whatever skill we're discussing. And then it gives you practical tools that can be used with adults. So we've encouraged wives to use them in, maybe use them in your staff meetings, use them as icebreakers, use them as openings, really to get people to open up, to know that it's okay to talk about these things. Like, we don't have to shy away the mental health conversation because we're afraid of what someone might say or what may come about. But then we also encourage the staff to use it within programming, right? So use the activities, which are like 5 to 10 minute activities within your program, so that we can build their skill set, so that as they grow and go in life, they'll be able to know what it feels like to build their resilience. They'll be able to know how to care for themselves, because it's like, we have our youth that we thought were so resilient that they were like rubber bands that would just pop back. And when the rubber band didn't pop back after COVID, we were like,
what happened, right? Sometimes the rubber bands broke. Yes, that's why she was Rookie of the Year. You absolutely.
But we have to build their skill set. So these Go Kids
are
helping to do that. And we always say very quick and easy ways to do it. And it really is quick and easy. And a lot of our YMCAs don't have a ton of money to go out and purchase these in-depth curriculums and all of this stuff. But guess what? You have this Go Kit that's free of charge. All you have to do is log in, get the materials, and implement it.
Right. Do what you can do. Not trying to suggest that we're going to replace professionals, right? Because that's another thing that we have to understand in this space, is that we are not replacing professionals. But we get that, right? We do it in health and wellness all the time. We'll tell people real quick, now look, I'm gonna tell you to do these crunches, but I ain't no doctor. So hopefully you get a 6-pack. I don't know, but we should be able to do the same thing in the mental health space. You keep crunching.
Exactly. I love that metaphor.
Yes,
right?
like we're not trying to supplant, but there is something that we can do. Like, we can lend to the space.
Well, I think about, we've got 15-year-olds on the deck of the pool there to save people's lives if they need them, right?
Absolutely.
We can be saving people's lives every single day, and we are.
Well, let me ask this. So you say that we got AEDs, and we teach CPR to the 16-year-old how to save life. Is there anything in the mental health space? And I know we got mental health first aid, and from the course that I took, I think it was 2 days at least.
It was long.
And so, is there anything out there for, and we got YMCAs listening and other different corporations and stuff listening to the podcast here, but is there anything that is out there that you could target for part-time staff? And what I mean by that is a shortened version of what we went through for 2 days, because, realistically, our staff turns over. I mean, a part-time staff is there probably 8 months, and, and so like sending someone through 2 days worth of training, it's a little tough.
Right. Yeah, I would point you to the suicide prevention Go Kit, actually. Don't you think, Keesiya? I think that, the one of the mental health ones to kind of ground in what we're even talking about. And then the suicide prevention is narrated by Donnie Goodman. I don't know if you know Donnie out of Seattle. My heart. I love Donnie so much. But it's quick. It's 8 minutes, and it's, designed to expose you, give you some of those skills, not necessarily make you feel like, okay, I can completely do this, because, as a therapist, I practiced many times asking questions around suicide before I started feeling really kind of like, oh, I got this. I know what I'm doing, right? So that's a good start to get some of those down and dirty details. And like you said, Keith, if there are people in your association who have a higher level, a higher degree of comfort with these issues, we got to make sure people know how to reach those people, and those people are accessible, right? So if I at least know that my, direct care team, the folks who see the people walking in the door, know, hey, you look like you're having a rough day. Is it okay if I give somebody a call and see if we can get somebody to connect with you and talk with you, right? I want them to at least know how to do that.
Yeah.
And then even better if everybody in every community knew how to ask those questions.
Yeah.
The suicide prevention training is uses the Columbia Screener, which is actually a free screener. It's, I think, 6 or 9 questions. And you literally can just pull out the sheet and ask the questions in a row. Like, you don't need to actually have any training to use it. It's helpful to have that training because, you know, it's a scary thing to be like, yikes, what if this person is thinking about dying? Well, I want to know, right? I'd rather know than just worry about that.
Right.
So the Columbia Screener is really, really helpful. And that's a tool in that Go Kit.
Nice. Speaking of tools, you both are providing thought leadership and co-chairing a group of Y professionals who are working on advancing like mental health preventative measures with YMCAs across the country. And in doing that, you all created this community care model. Tell us about the community care model.
Keesiya, do you want to go for it?
Go ahead, Sarah.
I can go for it if you want.
Go for it.
Okay, so essentially, you know, at its most simple, it really is just helping equip people to know how to take care of themselves and each other. So it's that mindset shift. It's really looking holistically at what it means to care for myself and how I need community to help with that. And how I need to provide care to community and how interrelated and dynamic those two things are.
Okay.
So these knowledge, skills, behaviors that we've been talking about here, those are really the pieces that we're trying, like if everybody knew how to do those things, like I always think like, if everybody knew how to do this and you went to the grocery store and you're having a rough day and you're like, get to the peaches and you just start crying and you had 3 different people in the grocery store, the clerk, the guy putting the vegetables in and everybody's like, hey, how are you doing? Do you need help? Like if ever, like, whoa.
Oh, so that's the community care model, like being in community, right? Like this, this connectedness, this togetherhoodness. Is that a word, togetherhoodness?
Now it is.
Okay, so we're going with it. Okay, so that because I was like, is it the community care model? Is it like because you know we come up with models in the YMCA for all kinds of stuff. So here's this model and here's this step and here's this. But this is more of talking about and helping people understand that there is an interconnectedness, a relationship between how I take care of myself, how I ask for you to help me take care of myself, and then how I take care of you. And if we can get that to be universal in the whole community.
I know, it's beautiful. And you know, so yes, I see the why as being integral to being able to help bring this to community. It makes sense. We're in community, we're about community. And I also often say, you know, like this, while this is kind of mind-blowing stuff, it really isn't, right? Traditional collectivist cultures do this, have always done it.
I think that's the thing that's so mind-blowing because it's so geniusly simple in nature. Like you feel like you're missing
back
something.
To basics.
This really is that it? That's the cheat code. He's like, well, dang, why I've been suffering so long? We should just do that. Man, I love it. I love it.
It's the stigma around the topic. And it's removing that negative stigma to say, simply put, we all need each other.
Yes.
Guess what? If you see me and I'm having a rough day, a little encouragement, a little help me to reset. We always talk about on the plane, you know, put your mask on first before you put someone else's on. But guess what? What do we do all the time? We go and go and go and do and do and do and do for everybody else until we're simply depleted. So we're trying to refocus that and helping people to see, guess what? When you take care of yourself, you can take care of more people around you.
Absolutely.
So simply just trying to refocus that energy and tell people, guess what? We can go a whole lot further if we're good and we can help so many more people in our own communities.
Absolutely. Especially around mental health, because at least to me, right, and I'm no professional, but it's health. And if you saw someone having a coughing attack, someone like your co-host, who every time you get on the mic, they decide that they want to cough, you would just hand them some water. Like, let me get you some water. It's the same concept right here. Like if you see someone that's struggling, If you see someone limping, they twisted their ankle, you'll give them a hand, help them.
Yes.
So we should think of mental health in the health. If they need help, let's just, and I'm glad you have water, Keith, so you don't have to come.
You know that part about twisting the ankle? Don't trip over the rug when you leave out of here, okay?
I want you all to know that if mysteriously I come up with a twisted ankle here in the next couple of days, it's like an episode of Snapped or something. I'm telling you right now who did it. I'm telling you right now.
I do think this is being recorded.
Right. Thank you. I have proof.
And I have editing power.
Well, that's right, because you're the tech person.
He's the tech person, right?
I mean, the nuggets that you all are dropping today is just really, really marvelous, because we have to be able to get in this space. I constantly think back to, again, when someone walks into our building, you know, how does our Welcome Center staff handle that situation?
Yeah.
And we got to find those right tools for as an organization to be able to take care of those frontline staff. When you think about the YMCA, 85%, I don't care what association you go into, 85% of the staff is part-time.
Yeah, that's true.
Yeah.
That's
Whatever association there is, and those are the ones. And so great that you can feed me, but man, I think we gotta figure out the system where we feed our frontline staff
and volunteers too.
And volunteers.
Absolutely.
I mean, there's not a sports program in the YMCA that's not ran by volunteers.
That's true.
So,
that's very true. Absolutely.
So how we figure that out? You know, we gotta continue to get there.
That's what these lovelies are doing with the group.
I know.
And I'm waiting for hey, I'm okay with being a follower in this. I'm okay. Yes. I need y'all. We need y'all. Thank you for using your time, energy, and your talents to kind of coalesce as a group and help us figure this out as a movement, because our staff deserve it, our volunteers deserve it, and our communities and young people absolutely deserve the why to show up in this way.
I agree. And so, you know, that's one of the things that is really central to this is we start with our staff. We start with our adults, right? Because if our team isn't healthy, we're not going to be able to sustain it. We're not going to be able to do it. And I wanted to add something that I've been thinking about a lot, especially as, you know, we're seeing more and more reports about learning loss and the impact this has had on communities of color. And we're just seeing all of the negative impacts that were very, very predictable, sadly, predictable.
Yeah.
And we know that we're going to be seeing some more of those impacts. And so one of the things that I think is really important for us to really wrap our brains around is that what is it that helps people heal and recover? Well, it's connections with other people.
Yeah.
It's safe places.
Yeah.
It's access to food and a sense of meaning and purpose, access to safe places, right? Access to healthcare. Those are all things within the purview of the law, right? Those are things, most of those things are things that why leaders can do even if they have absolutely no authority in the world, right?
Yeah.
Like at its most basic, we can connect with people and we can connect them to resources.
Yeah.
And
so
those are all simple and baseline things that we can all, there's no PhD that you need to get to be nice or to encourage anyone. And it's like, how do we practice those things more and more? I wish that I had a co-host that would do that with me more, but you know, that's not the case. And so I got to continue to work on that right there. But as we deal with our staff,
I knew he was gonna get it in before we finished, y'all. I know it. Just know. I was waiting for it.
we just have to figure those things out to practice more. I am going to practice being nice, as I always am to her. But you know,
this is a prime example of when practice does not make perfect, because I don't really know that you practice that, Keith.
You practice to play the game. That's Herm Edwards, former coach of the New York.
I can't.
So I'm trying to practice to play the game.
This is my life, y'all. This is my life.
Hey, look, you guys.
I've snorted many times during this podcast.
We appreciate what you guys are doing. Continue to uplift that. You know, as we push this podcast out to different people, we want to make sure that our associations across the board are getting this knowledge right here. The Go Kit needs to be publicized, advertised.
Please go on link. Get all of those
you guys,
resources.
share right quick where they can get this Go Kit at.
Yeah, on the mental health community page. So if you just do the little mental health, and you'll be able to find it. Can we also make sure it gets in the show notes?
Yes.
We will put it in the, we will put it in the show notes for sure.
Go and get it. It is there. I love the concept of these quick snackable. Everyone can do 8 minutes. You spend longer than that waiting in line for a caramel crunch frappuccino. Not that I know,
right?
But you know.
And with that going,
you gonna go get me a caramel crunch frappuccino?
Well, you're gonna go somewhere, but hey, look, thank you, Cosmetic family, for listening to us today.
On this very installment of our YUSA Innovation Series with the lovely, lovely, lovely Sarah Johnson and Keesiya Robertson.
Hey, subscribe and listen to us weekly.
And don't be shy, give us a 5-star review.
And as always,
dynamic,
be phenomenal,
be
Cosmetic.